Sulfacetamide-Prednisolone drops are used to prevent or treat eye infections and reduce swelling in the eye. The antibiotic in this product, sulfacetamide, stops the growth of bacteria, while the corticosteroid, prednisolone, reduces inflammation. It's important to note that this medication only treats bacterial eye infections and should not be used for other types of eye infections. Overusing antibiotics can decrease their effectiveness, so it's important to follow the prescribed dosage and timing for best results. When using sulfacetamide-Prednisolone drops, make sure to wash your hands before applying them. If the product is a suspension, shake it well before each dose. To avoid contamination, do not touch the dropper tip or let it touch your eye or any other surface. Before using this product, visually check it and do not use it if it has darkened in color. Do not wear contact lenses while using this medicine. Sterilize contact lenses according to the manufacturer's directions and check with your doctor before using them. Tilt your head back, look upward, and pull down the lower eyelid to make a pouch. Hold the dropper directly over your eye and place one drop into it. Look downward and gently close your eyes for 1 to 2 minutes. Place one finger at the corner of your eye and apply gentle pressure to prevent the medication from draining out. Try not to blink and do not rub your eye. Repeat these steps for your other eye if directed, and if your dose is for more than one drop. Apply as often as directed by your doctor. Do not rinse the dropper. Replace the dropper cap after each use. If you are using another kind of eye medication, wait at least 5 minutes before applying other medications. Use eye drops before eye ointments to allow the eye drops to enter the eye. Use this medication regularly to get the most benefit from it. Continue to use it for the full time prescribed, even if symptoms disappear after a few days. Stopping the medication too early may result in a return of the infection. Do not use this medication for longer than prescribed. If you use it regularly for an extended period of time, do not suddenly stop using it without consulting your doctor. Your dosage may need to be gradually decreased. Inform your doctor if your condition does not improve after 2 days. When using sulfacetamide-Prednisolone drops, you may experience some temporary stinging or burning in your eyes for a minute or two. You may also notice eye discomfort, dry eyes, tearing, itching, or redness. If these effects persist or worsen, it's important to notify your doctor or pharmacist. It's important to remember that your doctor has prescribed this medication because they have determined that the benefits outweigh the potential risks of side effects. Many people who use this medication do not experience serious side effects. However, using this medication for prolonged or repeated periods may lead to a new type of eye infection. Be sure to use sulfacetamide-Prednisolone drops exactly as prescribed and contact your doctor if you notice any new or worsening symptoms. Seek medical attention right away if you experience any serious side effects, such as changes in vision, eye pain, signs of infection, easy bleeding or bruising, yellowing of the eyes or skin, or dark urine. While very rare, a serious allergic reaction to this drug may occur. Contact a healthcare professional immediately if you notice symptoms such as rash, itching or swelling, severe dizziness, or trouble breathing. This is not a complete list of potential side effects, so be sure to contact your doctor or pharmacist if you notice any other unusual effects. And remember, in the US, you can report side effects to the FDA at 1-800-FDA-1088, and in Canada, you can report side effects to Health Canada at 1-866-234-2345. Before using sulfacetamide-Prednisolone drops, make sure to inform your doctor if you have any allergies to sulfa drugs or corticosteroids. This medication may contain inactive ingredients that can cause allergic reactions, so it's important to discuss any concerns with your pharmacist. Also, be sure to let your doctor know about your medical history, especially if you have any eye problems or have had eye surgeries in the past. After using these drops, your vision may become temporarily blurry or unstable, so it's best to avoid activities like driving or using machinery until your vision clears up. If you are pregnant, only use this medication if it's absolutely necessary and discuss the risks and benefits with your doctor. It's also important to consult your doctor before using sulfacetamide-Prednisolone drops if you are breastfeeding, as it is unknown if the medication passes into breast milk. When using sulfacetamide-Prednisolone drops, it's important to be aware of potential drug interactions that could affect how the medication works or increase the risk of serious side effects. This is not a complete list of all possible drug interactions, so it's crucial to keep a record of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share this information with your doctor and pharmacist. It's important not to start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with sulfacetamide-prednisolone drops include gentamicin, certain local anesthetics like tetracaine, and preparations that contain silver. Be sure to discuss any concerns or questions about potential interactions with your healthcare provider. If swallowed, this medication can be harmful. If an overdose occurs and serious symptoms such as passing out or trouble breathing are present, it is important to seek immediate medical attention by calling 911. Otherwise, contacting a poison control center right away is necessary. In the U.S., residents can call their local poison control center at 1-800-222-1222. For Canadian residents, contacting a provincial poison control center is advised. It's important not to share this medication with others, as it has been prescribed specifically for your current condition. Once your treatment is completed, make sure to dispose of any unused medication. Do not save it for another infection unless instructed by your doctor. If you are using this medication for a prolonged period, more than 10 days, your doctor may recommend regular medical and lab tests, such as eye exams. Be sure to attend all scheduled medical and lab appointments and consult your doctor for further details. If you happen to forget a dose, you can use it as soon as you remember. However, if it's almost time for your next dose, then it's best to just skip the missed dose and continue with your regular schedule. Avoid taking a double dose to make up for the missed one. Make sure to store sulfacetamide-prednisolone drops at room temperature and away from light. Do not freeze the solution and do not use it if the color has darkened. It's important to keep all medications away from children and pets. When you no longer need this product or it has expired, make sure to properly discard it. Don't flush it down the toilet or pour it into a drain unless specifically instructed to do so. You can consult your pharmacist or local waste disposal company for the proper way to dispose of it. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.